Welcome back to Low Vision School. I'm Dr. Dave Armstrong. I'm a low vision optometrist in Virginia. And today I'd like to help you understand the vision loss that is referred to as hemianopsia. Hemianopsia means that an area of the visual field has been lost to one side. And as you can see from this diagram, this is a patient of mine's visual field test. This black area is the area that they do not see in. See nothing with that area. This lighter area they have vision remaining in. So everything to this side of the vision is lost. And it's referred to as homonymous hemianopsia when it affects both eyes to the same side. So you can see these areas of vision loss are not identical, but they're very similar. The vision is lost to the left on both of these charts. This is the right eye, this is the left eye. And that is usually caused by a stroke or perhaps a brain tumor. And it affects the person's vision in a very profound way. They see nothing to that side, so it's not unusual for them to bump into things that they didn't see, trip over things. Sometimes a person will approach them from that blind side and they just sort of pop into view. They're not aware that they're coming toward them until they're almost straight ahead of them. So it definitely has a big impact on their vision. To my knowledge, there are no states that allow people to drive when they have a vision loss to one side, a hemianopsia, like we're describing. So there are a few things that can be done to make people safer in walking around, navigating their home or other unfamiliar areas. One of them that I am most familiar with is called side vision awareness glasses. This is a pair of side vision awareness glasses. And I want you to notice if I hold it like this, a little closer to you, that right lens is quite thick to the right side, the temporal side. That's the side that the person has lost their vision on. They have a right homonymous hemianopsia, and this type of lens would be helpful to them. If you look at it from the front, you can see there's a line, which is the edge of that prismatic part of the lens, but it's not cosmetically unacceptable from the front. The way this helps is by allowing a person to be aware of things that are to that blind side sooner. So instead of that, I mentioned the person walking up and not appearing until they were just about in front of them. With side vision awareness glasses like this, the person would become aware of them when they're over in this area somewhere. They can turn their head, they'll be able to see them better and engage with them if that's, or in the case of walking around their home or some other area, they see things to that blind side sooner, so they're less likely to trip over it or bump into it and perhaps injure themselves. So hemianopsia, a vision loss to one side. Homonymous hemianopsia means that affects both eyes, and a help with that problem is side vision awareness glasses. This is something that I prescribe for my patients who have that problem. So if you have experienced that, perhaps from a stroke, you know that there is a possible solution to the problem. I'll say again that states do not allow people to drive with a homonymous hemianopsia, nor would they allow them to drive with side vision awareness glasses. The glasses are strictly for the purpose of getting around safer, less likely to bump into things or trip over them. So if you have further questions, I'm always available. Give me a call at 866-321-2030. Thanks. I hope I've cleared up some of your questions on Hemianopsia. Thanks for watching. My low vision offices are in Roanoke and Waynesboro, Virginia. Call me now for a free telephone consultation. I'll ask you a few questions about your remaining vision and tell you if I can help you. Call me at 866-321-2030.